Some patients have surgery and they have a complication, or even without a complication, they're still not happy with the outcome that they had, and they have regret and remorse of their decision. I'm going to cover that topic in today's video, so stay tuned. Okay, well, welcome back. I'm Rosen, orthopedic surgeon, and I make these videos for educational purposes so patients like you can find reliable information. This story, though, is personal because I have, as a surgeon, taken care of thousands of patients, and many of them have had good outcomes. And I've watched a number of them have regret or remorse, whether or not they had a complication like an infection. But especially early on in my career, I maybe didn't do the best job of educating patients on what realistic expectations should be for a particular surgery. And I've changed that, and I've seen my satisfaction scores when we do patient-reported outcomes continue to increase. But I became a patient. So about a year and a half ago, I had some major dental work done. I was having severe pain, and I went and saw a doctor. Unfortunately, I had pain that persisted after the procedure, and to this day, I still have some symptoms, and I regret my decision. I have some remorse of what I asked them to do, and I wondered whether or not I should have gotten a second opinion or waited a little bit longer or tried something non-surgical, non-invasive, or maybe a different procedure instead of what I had done would have resulted in a better outcome. But I continue to worry and ruminate and deal with these symptoms. And if you've ever dealt with chronic pain, whether or not it's your feet or your back or your teeth, chronic pain can be debilitating, and it can be difficult both physically and mentally. Now, in my world, the most common surgery that I do is total knee replacement surgery. And total knee replacement surgery has been, over the years, talked about frequently as one of these surgeries where 20% of patients are dissatisfied. Now, again, when I look at my studies, because I believe that I do a good job of choosing the right patients, I sometimes talk patients out of surgery that want a surgery because I don't feel it's in their best interest. But through education and appropriate protocols, my satisfaction rate is 92%. I think that's pretty good, and I'm not here to pat myself on the back, but it shows that I learned over the past 20 years how to move the dial. But patients still, about 15 to 10% of patients and around the world that have knee replacements still have pain, and you might be here because you're one of them. Now, there are also other surgeries, like in the general surgery world, the role of hernia repair, ventral hernia repair. There's still a lot of patients that don't have realistic expectations, and then after what a surgeon might consider a successful surgery, those patients are not happy with the outcome, so they have regret or remorse. Now, complications can always occur, so sometimes patients have a complication like an infection, and they have significant remorse of what they went through because now they're dealing with a complication. The other common world in the surgical world where a lot of patients have regret and remorse are spinal surgeries. There's even a term called the failed back syndrome, and many patients that have had back pain that saw a back surgeon and were recommended back surgery had surgery and did not have a successful outcome or needed additional surgeries, and these patients then have pain and symptoms. Now, dealing with chronic pain and dealing with ruminations and remorse and regret due to both physical symptoms like pain and other symptoms can also cause mental issues. And patients can develop anxiety, they can develop depression, and now you have to work on not only treating or dealing with the chronic condition that was a result of the surgery, but dealing with the mental issues that come along with those physical symptoms or the result of that surgery. So it's important to heal as best as you can, and that is not always easy. And I talk from experience because I dealt with and struggled with this for a long time. So I think the first thing from a logical and scientific approach is to reassess the situation. Talk to your surgeon and find out, is there anything at this point that we can do differently? Is there another procedure? And if so, what are the chances of success? Getting informed consent of the risks and the benefits and the percentages to know what you might be in for if you choose to have an additional procedure. It can be also important to get a fresh set of eyes to take a look at things, and getting a second opinion is a very good decision in many cases to see if another doctor or surgeon sees some other way of approaching this problem that may decrease the symptoms that you're dealing with. But the other important thing, and the thing that I want to talk about here, is one way of how to move forward. And one way that was helpful for me when I was going through my struggles with depression and chronic pain. And this is what's called mindfulness-based stress reduction. So there's actually been studies in our literature that have looked at mindfulness-based stress reduction, which is MBSR, or mindfulness-based cognitive therapy, MBCT, for patients that are dealing with chronic pain. And what's interesting is if you go back decades, there is one important person named John Kabat-Zinn, who at the University of Massachusetts developed this mindfulness-based stress reduction course. It was an 8-week course. And unfortunately, back then, they found that they were sort of the last door that patients were sent through when doctors were basically throwing their hands up in the air and saying, I don't know what else to do to help you. I'm out of options. Go see these other people. So previously, this was an option of last resort. And again, there's many other ways that you might address this, but I'm going to talk about this mindfulness-based approach because many patients have found success with these options. So mindfulness-based stress reduction puts you through an 8-week course. Now, one option is you can read his book called Full Catastrophe Living. I will admit, I bought the book and I was pretty overwhelmed because it is really thick. It was an easy read, however, and when you're dealing with chronic pain and every page offered an analogy or a solution or a patient experience, that I found the book helpful and I read it from cover to cover. The other option is you might look into a mindfulness-based stress reduction course, and I recommend this to a lot of patients that are dealing with issues, whether or not they have chronic pain because of a disease or because they had surgery. You can find these courses online. So you can do an 8-week course online, or many institutions offer these in person. So you might just Google search the local hospital system in your area, and you might find that they have a mindfulness-based stress reduction course that you can go and participate in, and many patients have found success with this. What I always find interesting, and again, because I've been a meditator for a number of years, but even John Kabat-Zinn will say he finds it interesting that in a practice of mindfulness, where we're basically asking people to do nothing, basically sit and focus on the breath, for example, that it can do something. And the results have been extremely promising for many, many patients that have been struggling with chronic pain and depression and other illnesses, especially if there's not a simple fix or cure. Now, the other option is mindfulness-based cognitive therapy, which basically takes CBT or cognitive behavioral therapy and combines it with a mindfulness-based stress reduction course incorporated. So that becomes a really, really good course for people that are not only dealing with a chronic pain issue, but also with significant psychiatric issues like depression. It's basically taking the two schools of thought and melding them or merging them into one. So again, today's video is not to offer you a simple solution, because many times if you're dealing with chronic pain, there is not a simple solution. But if you've been dealing with chronic condition and doctors that you have seen have basically thrown their hands up and told you that there's nothing more that they can do for you, again, if you haven't gotten a second opinion, I strongly encourage patients to get a second opinion. And sometimes that does mean traveling a distance to find an expert for whatever problem you're dealing with. But also consider mindfulness-based stress reduction courses. And you might find that an 8-week course can change your outlook and offer you skills and techniques that allow you to come to terms with the pain or symptoms or issues that you're dealing with. And it may just lower the temperature on that thermometer, and you might find that it just improves not only how you feel, but your whole outlook on life and your symptoms in general. And if you do take the course and you find it to be helpful or not, leave a message in the show notes so other people that are like you, because you are not the only one out there that is dealing with this, can hear your story, and maybe even share where you took the course so someone in your local area may see that and think that this is an opportunity that they can look into and hopefully begin to heal from whatever they're struggling to deal with. So again, thanks again for watching, and I really wish you the best. Until next time, I'm Adam Rosen. Stay safe.